Good afternoon. I'll now present a second update for South Australia today. This morning we reported that we had results in for both the grandson and the daughter of this 81-year-old gentleman who had returned to Australia from Argentina. We now need to confirm that the daughter has returned a positive sample. So this is very significantly escalated our concern with regards to this case. I can report to you all that in fact we have other results, 5 other results which have come back in negative. So that is positive for this situation, but certainly the positive result for the daughter is very significantly increasing our anxiety at the moment, and we have no choice but to put in enhanced restrictions in place as of midnight tonight. These will be statewide restrictions that are being put in place, and they'll be in place, and we'll review those on Friday this week. We've only got one chance to get this right. We're very concerned about this situation. We are assuming it is the Delta variant. We can see what happens in other jurisdictions around the world where there are delays in putting restrictions in place. We don't want that in South Australia. Our focus right from day one has been to go hard and to go early and to minimise disruption to business. And I think we've shown over a long period of time that South Australia has had the lowest level restrictions and the lowest level interference with business in terms of days lost due to lockdown. So we've got to respond quickly, and that's what we'll be announcing today. Effective as of midnight tonight, we move to level 4 public activity restrictions, which means moving back to 1 per 4 square metres, outdoor dining only, no communal consumption facilities, seated food and beverage consumption only, all CMP events cancelled. We're also cancelling the use of shisha bar or the opening of shisha bar. We're putting caps on private activities at 10 now. Masks are going to be required for all high risk settings. We will want and require masks for passenger transport services, masks for shared indoor spaces where physical distancing cannot be maintained, the continuation of restrictions on dancing and singing, restrictions to be put in place on sport, all sport in fact. Indoor fitness facilities will be closed, no team or club contact sport, and personal care services are closed. We also close all non-essential retail. So this means that we can still continue to go to the pharmacy, we can still continue to go and get our groceries and key items that are required, but we are closing non-essential retail as of midnight tonight. We do this because we only get one chance to stay in front of this disease. Obviously, we'll get far more information back overnight. If we can ease these restrictions, we will. But if we wait until we get all of the available information, it can often be way too late. We don't want the heavy restrictions, the long-term heavy restrictions that we're seeing in other parts of the world, other parts of the country at the moment here in South Australia. So we do this to get in front of the game as quickly as possible.
Premier, does that, or two things, why the difference in testing from this morning to this afternoon? Was there an error made?
No, there's 2 types of testing. The first testing, we go in and do a very rapid test, and then secondly, we follow that up with a full PCR test, which is the swab that's taken from the throat and the nose, and it's on a very much more sensitive piece of equipment. What we now have is a weak positive that's come back from the second test. We never leave it with just the first rapid test, which will give us an indication we followed up with the PCR test. That's come back with a weak positive, which could mean we've got it very early, and that's great news, or it could also mean that it's quite late, and that would be far more problematic. We just don't know at this stage.
So what's to stop the rest of the family having positive tests, seeing they've already...
Well, as we pointed out this morning, we had the rapid test. Those test results have come back in. Some of them are now coming back with the PCR results, and to date, all five of them, apart from the daughter, have come back negative. So that's fantastic news. But, of course, what we now have is an expanding list of exposure sites. So this gentleman, and now his daughter, could have come in contact with people during an infectious period. We've now got to get in touch with all of those people at all of those sites that were there at that time, get all of them into quarantine, make sure that they are secure and that they have their tests, and then we need to get all of their close contacts also into quarantine. So this is a massive operation, and we can't do it with everybody moving around the state. The more movement that there is, the longer it's going to take us to get on top of this particular case. Now, I'm hopeful that we can do this quickly and efficiently, but we need the cooperation of the people of South Australia to make sure that we don't have extended long-term lockdown in South Australia. Now, I know that these restrictions are going to put a heavy toll on businesses and on individuals. It's going to frustrate plans that people have already put in place, but they're necessary. They're absolutely necessary. This is our one shot to make sure that we don't go into long-term lockdown in South Australia.
Premier, can I just clarify around passenger transport services and masks? Is that public transport as well as Ubers and taxis and the like? It's across the board?
Correct.
So did you say until Friday these are in place?
Yes, we'll review the situation. We'll obviously be getting information in almost on an hourly basis at the moment in terms of the number of people that we're putting into directed quarantine, the results that will be coming through. We will be reviewing those, and if there is any change to the situation, then we'll certainly keep the people of South Australia informed as quickly as possible. But at this stage, we envisage that we won't be reviewing this situation until Friday.
What about schools, Premier?
So I might just get the Police Commissioner to go through that, because he's going to be putting the direction in place, and as I said, it will be a statewide direction, and it will come into force as of midnight tonight.
I mean, can I just, sorry, before you
Yes.
do, are there any plans or discussions about what type of relief you might be able to offer businesses that are affected by this? Lots of events, football, etc., that are now cancelled because of this. What?
Look, our focus at the moment is making sure that we minimise the effects on business. We want to make sure that we can have the smallest disruption that we possibly can. It's a disaster if we have to go into a long-term lockdown. Obviously, there is federal government support if that does take place, if they trigger this as a hotspot, and there's money available in the second week. But my goal is for us to all work together this week and make sure we can get on top of it. Hopefully on Friday those restrictions can be lifted. I'll pass over now to the Police Commissioner.
Thanks, Premier. So just a little bit more detail. This is, we're formulating a general direction which spells out the levels, and some of you have copies of one of those drafts in relation to what those levels look like, and we're talking about level 4 restrictions. So this is not a lockdown, but it is clearly significant restrictions on public activities within our community. The Premier has outlined most of those sufficiently, I think, and you have copies that you can take away the specific details of. One thing that needs elaborating, I think, is the ability to continue. We're restricting non-essential retail, which means the sorts of things that will continue to be open are retail and wholesale of activities for food and other essential items, and including newspapers and other personal care type retail activities. We're talking about household consumer products that are essential to maintain the safety and cleanliness and well-being of a business or premise, home or business. Pharmaceuticals and chemicals retailers are able to operate. Opticians and optometrists, businesses that are selling medical and orthopaedic goods, fuel stations and heating fuel providers, retailers involved in the repair of motor vehicles and other forms of transport, bicycles. We're talking about the retail sale of essential items for the care and well-being of animals, laundries and dry cleaners, laundromats, post offices, banks, credit unions, retail sale of safety supply stores such as work clothes and other things that are required by some essential workers. Hardware stores are able to remain open. There will be a comprehensive list that will be included on the website, and we'll circulate that through our social media platforms as well, so people have a good understanding. This is an indicative list at this stage and it's still being crafted. In terms of schools, schools are, as well as offices, unrestricted activities, which means the requirement to wear masks in indoor public settings does not specifically apply to schools or offices, but there will be requirements that need to be worked with through our consultation with the Education Department and other sectors as well, so that they can understand exactly how they apply that in a safe way.
Now, Commissioner, can I just ask you, and apologies if this was detailed earlier, can you just elaborate on what the direction will entail about working from home or in the office, please?
There will be no specific reference to working from home in the direction, although working from home is strongly encouraged over the period that this particular direction is in place, that is intended to suppress all non-essential activity in the community. We're also asking people to minimise non-essential travel, particularly to the regions and most specifically to the Riverland, whilst we're dealing with the outbreak that may occur and impact on South Australia from Mildura.
Commissioner, you say sports. Now, there's a match planned as far as I know. Latest details I have Friday night here. This goes till Friday. Is that game still a possibility?
SA Health will work directly with the AFL. As we've said before, the AFL have a significant set of protocols in place for safely managing AFL games during the pandemic. So I don't have an answer in relation to the status of that particular game, but SA Health will work directly with the AFL.
It would seem unlikely there'd be a crowd there under any circumstances.
I think, given that there is no spectators allowed at any sporting activity under these requirements, then I think you can safely assume that even if we do get to a point on Friday afternoon that we are more comfortable with the situation in South Australia, any crowd numbers would be substantially reduced.
Just further to that, Friday is possibly not an ideal time for a team to travel here to play. The AFL would be wanting some clarity before then, I'm sure, but you won't be able to give that.
Well, as we've done before, SA Health will work directly with the AFL and the affected teams to establish whether or not we can create an environment where they can play the game, whether it be here or somewhere else. So those conversations will be happening almost immediately, I'm sure. And the intent will be to have clear position going into that time frame that they need to travel or make arrangements.
Commissioner, was the advice to go to level 4 or was it to go even further?
The advice was initially to go to level 4. We tested that in terms of the implications. We are acutely aware of the implications of going to level 4. We know what this does to people, both socially, personally, from an economic point of view. We know there are people who will struggle as a result of these changes, but the consequences of not acting now could be far more severe. So we've taken this decision, having looked at lighter alternatives and also whether or not we should go to a full lockdown at this time.
Did you say masks at schools and in the workplace are not required?
Masks are required in indoor public settings, but schools and offices are cut out from that, and we'll work directly with those sectors to ensure that they understand how they safely manage their workplaces. Given that we're encouraging people to work from home, we should be suppressing the level of movement and activity in office buildings.
What sort of shopping centres, indoor public spaces, you mean shopping centres and stuff like that?
Any indoor public venue, anything with a roof on it where you're mixing with people that you don't normally congregate with, a mask is required.
When you talk about retail, and retailers, big ones such as Big W and Kmart, who sell food and essential goods,
yep.
Is there a differentiation between that? Can they stay open?
Well, I would argue that clothing, certain types of clothing, would be essential. So there's a difficulty in being definitive with this list that you're going to properly capture everybody that should be captured in terms of being able to trade and excluding those that should not. So there'll be a business by business assessment in some respects as to what they can trade in and what they can't. But the intent here is to dramatically suppress all discretionary activity within the community without going to a full lockdown where we require people to stay at home.
What sort of compliance, I know you talked about education, as has the Professor and others. What type of compliance and what directions are you giving your officers over the next 5 days in how to handle the lockdown and people that may or may not be complying with the new directions?
Well, firstly, it's not a lockdown. It might seem like that, but that is a significant next step that we are hopeful we don't have to take. History shows us that the South Australian community have done exceptionally well in complying with these severe requirements. That's what we're expecting again. We haven't seen any significant need to dramatically increase our compliance level activity within SAPOL. We'll be working with SA Health to identify where we need to put those resources. Once again, we'll be taking an education approach, supporting people, and we'll target those people who just clearly just don't have any regard for the impact of the potential spread of the virus on the community.
So no team sport, but individual sports like horse racing, can they still go ahead without spectators?
That would be my understanding. It's team sport and contact sport.
Professor, if you don't mind, thank you, Commissioner.
Thanks.
Professor, are you able to provide us, or actually to start with, was your advice just to go to level 4, if it wasn't to go to a lockdown straight away?
No, I don't think that we need to go to a lockdown. We still have got some time. We've got 2 people that are positive, and I will just explain about the daughter's test. So the initial was a swab, nose and throat swab, and that was done up at Modbury Hospital. And there are different machines that it goes on, and the initial was put on at what's called a Gene Expert. It takes about 45 minutes to run, so we get a very quick result. We've got extremely expert virologists in SA pathology, and they had a look at that result this morning. They reran it on one of their more sensitive machines, and it is a positive. It is a weak positive result, and they've also taken a second swab to verify that. They've also, and very quickly, taken some blood to look at serology, and that looks at the antibody levels of this particular person. And those antibody levels are negative at the moment. So this gives us 2 different scenarios, and this is the daughter. She has either caught this from her father, and she's in the early stages of the infection. And that's possibly the most likely scenario here. The other scenario is that she was initially infected, and she's at the end of her infection, and she passed it on to her father. Now, the only way of really telling that, and people might think, oh, well, if the antibodies are negative, then it must be early in the onset. There are some people that don't have an antibody response, so it's not absolutely cut and dry at the moment. The way of telling this is taking another swab tomorrow and having a look at the result of that to see whether we get a stronger signal. So at any rate, it means that not only have we had the gentleman in the community with exposure sites, but we now have the daughter. Now, she spent a lot of time with her dad, so many of the exposure sites are overlapping with those that we already know about from her father, but there are some additional exposure sites. And I have to say a big thank you to this woman. She has had a very difficult 24 hours. She hasn't had any sleep, and she's giving us a lot of information so that we can get these exposure sites out to the community. So what this means is we've got her and the fathers, the 16 people that are around them in terms of their close family members. But what we do not have yet is all of the people that both she and her father have come across over the last week and could potentially be infected. And that's why that's why I've advised that we have this period of time where we very significantly reduce activity in South Australia. What we know from interstate with this Delta strain, and again, we haven't confirmed that, but that has to be our assumption at this stage, is that it moves very rapidly. And by the time people are being found as a case, they've already passed it on, not just to one person, but that person's passed it on, and we've already passed a number of generations. So we don't have time. What the plan is that we ask the South Australian community to have these restrictions in place, reduce the movement, whilst my team do all of this contact tracing. We're really supercharging our contact tracing. We're bringing more staff in, but we also have an IT system where we can SMS people. We've got the QR reader system. So that means that we are more comprehensive with getting close contacts. So whilst we might have been able to get, maybe 50% of close contacts, it would take us 2 or 3 days. We are able to get larger numbers of close contacts. But of course, they need to be tested. We need to be collating those results, and that's what we'll be doing, working very hard over the next couple of days.
So has she been transferred to Tom's Court now that she's...
Yes, she has. So that was being organised this afternoon.
So we don't have the genomics yet, do we? We're not.
No, the lab has got that started, so the process has started to have the virus cultured and then do the genomics. And when I spoke to the laboratory, they said that it is likely to be late tomorrow afternoon.
How many messages or have you sent out so far, Professor, and have you been able to get numbers on how many people have been identified as visiting these Adelaide exposure sites?
Yeah, so I thought you might ask me that question, and I'm afraid I don't have all of those numbers because this is being done in real time. But as soon as we have some counts on that, we will be able to let people know. Certainly, if you've received an SMS message to quarantine and get tested, please do that immediately. The other thing is, just to put this into context, this is on the back of having a significant exposure with Phillip Island and also in Mildura, and so and also the MCG. So we already have surveys up on our website for those sites. People may have filled those out in South Australia. Now we have, obviously we're bringing in more people, but we have a limited number of people to go through all of those surveys, and now we're reprioritising on this particular event in South Australia. So I just wanted to make the point, if you are listening to this, you filled out a survey, you're considered a close contact because you were in Mildura or you were at the MCG and someone hasn't contacted you yet, I do apologise. We will be getting to you, but we will be prioritising at the moment for the surveys for these particular South Australian locations
now. Can
now.
you just clarify, he didn't travel from Australia to Argentina recently? He was there before the pandemic?
Yeah, my understanding was that he has been in Argentina for some time. His daughter went over, she's been there since February, and then she travelled back with him.
So wouldn't it have been high risk for him to come back from a South American country in the first place?
Look, I can't make any comments about this. This is done at a Commonwealth level. They make the decisions about our vulnerable Australians. I'm presuming he's a vulnerable Australian, and he's obviously got a large family here that we're keen to have him in Australia.
And Professor, just on the point of the timing of this, the data you've got at the moment and your gut feeling on this, what is the crucial time? Is it tomorrow, the next day, or Thursday that we would, if we're going to see numbers, that's what you're most worried about?
So if we think about the number of exposure sites, and at the last count there was somewhere between 10 and 15 exposure sites, some of those which are already up on our web are places where there would be potentially quite a lot of people going. So we need to be getting hold of all of those people, getting all of those people tested for all of those exposure sites. And so that's going to take a number of days. As you can see, we've been able to get fairly quick testing, given that we only got this result back 2:30 a.m. We're really moving forward, getting these people tested and doing the interviewing, but it does take some time. There's the practicalities. For example, one of the swabs that we're waiting on from the close family members was done at Gawler, and so that swab now needs to come down to Adelaide to our lab here.
And can we just clarify, the woman's son, he was a teacher at the school, is that right, not a student?
That's exactly right. He was a teacher at the school.
And
Yep.
so he didn't go to the school in the school holidays?
No, but it was a very precautionary measure because sometimes you have teachers, you know, doing after-school care during a school holiday period or having teacher education, and so that was done as a precautionary measure. But that was one of the first tests we got back this morning, and that was negative.
There were also a few questions after the first press conference about why they were allowed to come from Sydney, because we'd already closed the border to Sydney before they actually arrived. Was that because they'd already done their 2 weeks quarantine?
Yes, yes, absolutely. So people that have quarantined already, because they're international arrivals, we do require them to have a direct route from their hotel straight to the airport, wearing a mask, getting on a flight and getting here. But as people are now aware, there was a young lad who did exactly that, and he was with his mother, and he was infected by the time he got to Brisbane. Now, whether that happened in the taxi, whether that's happened on the flight, these are all questions that are unanswered at the moment. One of the things that we will be doing, and I've already contacted New South Wales, is getting the results of the testing that was done in New South Wales, and also the flight manifest when these people came over, because as well as doing forward contact tracing where we're looking for people that have been in contact with these infectious cases, we also need to look for the source, and that's the back contact tracing.
Professor, with regards to the SA Health staff who've been moved from the Modbury Hospital, have any additional staff now been placed into hotel quarantine at the Stanford, or does that number remain at 25 as announced this morning?
Yeah, so that has increased. There's now 57 staff from Modbury that have been transferred or in the process of being transferred. And I just have a little bit of an update as well on the Modbury Hospital ED. Sorry, I just got to put my glasses on. the people working in the ED are just concerned that they might not have captured everybody that would have been in the ED at the time, and so we will be putting up the Modbury ED as an exposure site, and that will be from 10 p.m. on the 18th of July, which was a Sunday, to 8 a.m. this morning, the 19th of July, so Monday. So if you happen to be there, we are going to be considering this an exposure site, and you haven't been contacted, please go into quarantine and get tested, and also fill out our survey, which gives by filling out the survey, it allows our staff to know who's been at which exposure site.
Just so we're really clear here, Professor, those 57 staff members, they'll need to be spending those 14 days at the Stanford in essentially hotel quarantine.
Yes, exactly. So this was a discussion that we've had with the hospital and also with the staff. Many people live with family members, and so they were considered, because it was a high risk exposure, that it would be better that they would be in a hotel.
Professor,
Are
can I
there
just
any
ask-
other exposure sites added to the list as a result of the workers' positive result, or are there any more that are anticipated by this afternoon?
Yes, so just as we were coming to the press conference, I had an update from the staff. It looks like there will be another approximately 4 exposure sites, so they will be going up this afternoon. So everybody needs to keep a close eye out for those exposure sites.
Professor, what have you been able to ascertain what hospital the gentleman was in Sydney?
My understanding it's the Prince Alfred Hospital.
And we don't know yet where he got it.
No. So we will have the genomics back hopefully late tomorrow afternoon, and that will give us that fingerprint of the strain, and it's our expectation that it would be the New South Wales strain, but you never know. So until we get that, we are making a presumption that it's going to be Delta, the Delta strain, and one of the reasons for that is that we have across the world seen that strain really become the dominant strain.
And can you tell us why the decision was made to put these restrictions in place for the whole state and not just Greater Adelaide or Adelaide?
Yes, certainly. Well, there's a couple of reasons. The first is that we've had school holidays, and we've had lots of people travelling to different parts of the state. I've had a very recent vacation myself, which was very pleasant, but it did mean that I travelled to another part of the state. So that was one of the reasons. The other reason is what's been happening in Victoria on the other side of the border in Mildura, and our concerns for the Riverland area. So it really made sense to us to make this the whole state.
And with the 4 additional exposure sites, are they at this stage looking like they will also be in the northern suburb?
Yes, it looks to be mostly confined to that particular area, yes.
Professor, can I just get your expert opinion, please, about where the state is currently and what we're facing over the next couple of days? Is this the most serious that we've faced, outside of the parafill cluster?
Yes, most definitely. This is the time that we have had quite a significant number of exposure sites. We were concerned when we had the minor come back, but fortunately there were minimal exposure sites. We were able to get on top of that very, very quickly. The second issue we've had more recently with this Delta strain was obviously the removal is coming into South Australia. We are coming up to, I'm trying to count in my head whether it's 10 or 11 days now from the time they came through our state. We've had lots of contact tracing, but we really only had those 2 exposure sites, or 2 public exposure sites, plus the family's home. So that in a sense was limited. However, and also I have to say, of course, there was mask wearing by those men during the time that they were in the exposure locations. So this is quite different. We have a larger number of exposure sites. However, I'm a very optimistic and positive person. I think we will get on top of this. We want to go hard and early, but that means we do need everybody in the community to get on board with this. And I absolutely know that it is very difficult for small businesses when we request them to shut, but it is not a full lockdown. Just to stress again, there is not a stay-at-home order. I don't think we're at that stage yet, but this will bide us some time to try and get ahead. We haven't, other than the daughter and the father, we haven't had a transmission here yet in our community, but I don't want to wait for that to happen, because by the time that happens, it's too late if we have people moving around at the rate they are at the moment.
Why not go a little bit harder? I mean, we've seen in New South Wales they didn't lock down soon, and it's looking like their lockdown's going to go for 6 weeks at least. Why not do a short week-long lockdown?
Yeah, so it does have an enormous social and economic impact, and also on people's mental health. And so we have to weigh up the information we've got at the moment and those impacts. And because we haven't had any actual transmission in our community that we've been able to pick up as yet, I'm happy to wait 24 hours to get more information in. But it is very important that we do bring this level of restrictions in. For some people, they'll go, wow, gee, that's a really hard lockdown. Others might say, like you've said, we could have gone harder. So it's a difficult job that the Commissioner and I and the Premier have, trying to walk that tightrope and try to work out what would be the best for this particular situation.
How much capacity do we have in the COVID positive hotel? If we get another few cases, will we be okay capacity wise?
Yes, I think we're doing okay. It's fortunate that we did have a reduction in flights coming in internationally, and so that's given us a little bit more capacity. At the moment, we've got 14 active cases.
Can I just ask, thanks Professor, Commissioner, very quickly, it's an easy one, just yes or no answers to this, with
Sounds
open
like a
or
lawyer.
closed, yes or no, hairdressers,
No.
bottle shops,
Yes.
beauty treatments, nails,
No.
waxing?
No.
Thank you.
Is that for you?
Great.
Sorry, Lisa. In your view, what are we staring down?
Well, we have a scenario now that compels us to take some decisive action. And this is the one shot we get to get ahead of this. People will judge the decisions we've made today with the benefit of hindsight sometime in the future. Hopefully, they'll be saying that we may have overreacted, because it means we've once again avoided seeing COVID-19 have a massively devastating impact on our community. We don't want a lockdown. This is a significant set of restrictions we're putting in place, but it is not a lockdown, and if we can get on top of this particular situation with the measures that we have in place over the next few days, then I think we'll be very lucky. But time will tell, and I'm sure we'll be keeping you updated as to the progress in relation to those people who have possibly come into contact with this particular family, and the work that's being done by SA Health to work through the high-risk exposure sites and those close contacts.
Sorry, I just have one more. There's a lot of questions about weddings and funerals. Are they considered the home gatherings 10? Private
gatherings of 10 people. So it's the people that you normally reside with plus 10. If you're in another location, it's 10 people. So we understand what this means for people, but weddings and funerals are at 10. All being well, we'll be able to make some changes before the weekend, but I'd certainly appreciate what this does for people's plans.
And can I just clarify also, excuse me, on retail? I know Smitho asked about Kmart, and for example, what about things like Bunnings, IKEA, those types of, you know, what some people might deem as essential, others might deem as non-essential?
Well, hardware stores are allowed to open. I can't be specific in relation to furniture stores, but we'll liaise directly with those affected large retailers so they understand their position.
Thank you very much,
Thank
Commissioner.
you.